the 3 most toxic medications for your heart. I'll talk about commonly prescribed ones, not the obvious chemotherapy agents, ones that millions take every day. I'm Dr. Evan Levine, board-certified cardiologist. If you enjoy my videos, please like, share, and follow. Let's start with the ADHD meds, the meds like Ritalin and Adderall that chronically increase the levels of your norepinephrine and slightly increase heart rate and blood pressure and may have an effect on the heart as well. And this is a warning to all the parents out there and the docs who prescribe this for cash. You know, I don't accept insurance to kids, not because the child had terrible ADHD and actually needs it, but because it helps them perform better on exams or in sports. Oh, Tim hit 360 in Little League this year thanks to Adderall. Or Nancy's SAT score went up by 50 points. Frankly, it's borderline child abuse. Hey, the FDA had great concerns about this, but only looked to see what the risks were up to 2 years on these drugs. Bet Pharma was happy about this and they found no risk. But these kids could be on this for decades. Well, in March of 2024, a study in the Journal of the American College of Cardiology noted, they found there was a 57% increase in cardiomyopathy. That's a deadly weakening of the heart, with 1 in 500 children getting this if they were on the medicine for 10 years. Now that risk seems small, but in a 50,000 seat baseball stadium, that means 100 will get a disease that will definitely shorten their life. Would you take free tickets to a game if I told you 100 people sitting there would get a potentially deadly illness? Now, Adderall is the 17th most commonly prescribed drug in the US. And as you know, there are a bunch of these online sites that, well, hey, for the right amount of money, they'll prescribe it to you. It should be used in people who need it to function, not to have a higher batting average or SAT score. Number 2, antibiotics like Cipro and Levaquin, called fluoroquinolones, are linked to dangerous enlargements of the aorta. How so? Well, the FDA even issued a warning about this in light of this concern, saying that fluoroquinolones shouldn't be used in patients at increased risk unless no other treatment options are available. Now, these high-risk patients include those with peripheral artery disease, hypertension, or genetic conditions like Marfan syndrome and Ehlers-Danlos syndrome, as well as elderly individuals. The FDA failed to note that bicuspid aortic valve patients are also at very high risk. Now, these same antibiotics can cause life-threatening arrhythmias. That's right, those fluoroquinolones like ciprofloxacin and Levaquin, for example, fatal arrhythmias, ventricular tachycardia. By prolonging the relaxation part of the electrical impulse called prolonged QT interval. Now, this is especially in patients on other drugs that cause prolonged QT interval or low potassium. I actually was an expert witness on such a case where a patient died. The FDA says, advise all patients to seek immediate medical treatment for any symptoms like palpitations. The FDA also says that patients should seek treatment if they have any chest pain or anything that might be thought of to be an aortic aneurysm. I don't know how the patients would know this, but that's what the FDA says. Number 3, NSAIDs, non-steroidal anti-inflammatory drugs, over-the-counter or prescription drugs like Advil or Aleve or Celebrex or Meloxicam, they all work basically the same. They can all increase your blood pressure and cause retention of fluid or even renal failure in some, especially diabetics or people with hypertension or heart failure that use it often. Again, here goes the FDA. They issue a black box warning, you can see this, for all NSAIDs, including Celebrex, regarding the increased risk of cardiovascular events. Now, remember, millions use NSAIDs, millions, which gave me the reason to call them one of the most dangerous drugs for your heart on the market. That's right, you can just walk into any store and buy them. And hey, they help your pain, so you take them every day until something happens, like hypertension, renal trouble, heart failure, or even a heart attack. If you need to use them, use it only when needed, and make sure your physician knows about this. It's a drug. Maybe they need to monitor you. I hope that helps. Let me know you're interested by commenting yes, and feel free to share this video if you found it useful.